Welcome to Family Medicine in 5. Today we're going to talk about dehydration and IV fluids. We're actually going to start an IV and I'm going to show you how it's done. We do a lot of IVs, or at least a good handful of them in family medicine. There's two main types of IV fluids that we use. One is called NS for normal saline, which is just plain saline, and one is called LR, which stands for lactated ringers. Lactated ringers has a little sugar in it. It's got some electrolytes in it, so I use that a lot on my dehydrated folks. There's also one called D5W, which is sugar, and I don't use that very often. It's mostly hospital work. Most of the time that we use these is for dehydration, so it's mostly nausea and vomiting. Sometimes it's fevers or migraines. Remember, when you have a fever, you lose fluid just through your pores, just by sweating it out. And so that's why our kids often get dehydrated very quickly. Signs of dehydration is you'll have a dry mouth, a cotton mouth, or you won't have any tears when you cry. That's how we often tell with our babies if they're dehydrated. They won't be urinating as much. The urine looks very dark, concentrated, and sometimes smells foul. And there's something called skin turgor, which if you lift up the top of your hand like this, it should bounce back like that. If it sticks up, that's usually a sign of late dehydration. To check for dehydration, I often will check a patient's urine and look for something called ketones. Ketones is a byproduct of muscle. And so when your body is using muscle for fuel, so it's dehydrated, then ketones will go out in the urine. Okay, let's start an IV. Let's show you how it's done. Set up the IV. So this is a bag of lactated ringers. This is a liter. So it's 100 milliliters. Anytime you want to start an IV, you have to burp the bags. You see how much air comes in the top of this? So you don't want to put that into somebody's vein. So you're going to pull up your tubing. I'll open this up here. And you actually need to break the seal on this. So you're going to pull the top off and then I use just the tip of the tubing to break it, to open it up. And then you're going to squeeze all the air out. So we call it burping the bag. And then you're going to re-put this back in. Hang it on your IV pole, and you've got what we call bleed the line. So again, the tubing is going to have a whole bunch of air in it. And so I don't want to put that in the patient as well. So you can see it's already starting to come down into the tube. And so I'm just going to pull the top off and let some of that fluid roll out and then stop it. It's ready to go in the patient. Okay, so let's get started. So we need a few supplies at first. We'll need a pair of gloves, of course. We need an IV start kit, the needle that I'm going to use, and I'm going to use a 20 gauge and then a flush. Now remember with the needles that the smaller the number, the bigger the needle. And so that's actually the lumen, so the hole inside the needle. So if I use a very small needle, it's going to take a long time for that fluid to go in because the hole through the needle is so small. So if I'm working on dehydration, I usually try and do a 20 gauge on adults. And a lot, it depends on how good the vessels are. So our IV start kit, we'll open this up and I'll show you what it looks like. It should have a tourniquet. It should have some tape that you're going to need. It has an iodine prep pad and an alcohol prep pad, some gauze, and then a tegaderm to hold it down. I usually will use the patient's stomach and just say, hey, we're gonna prop all of this up on you for a second so I have easy access. So first, we want to find our vessel. So every time I use a tourniquet, I try and put it over top of their shirt because sometimes it really bites their skin and I don't want to give them any more bruises than they might already have. So go ahead and pump your hand for a second. And now we're going to feel where the vessel is. Now don't poke a patient until you feel comfortable. Remember, when you're trying to find a vessel, it's all about feel, not about look. So as we look at this, you can see there's some vessels right here, but these aren't very good. But I can feel a really good one right here. So typically we're going to go for what's called the anacubital vein. And so a vein that is really plump, so you can kind of push it down and it will bounce back. Remember, there's some tendons in here as well, and so if you hit a tendon, that's really painful for a patient. So you want to make sure that you're completely ready to go before you poke them. Okay, so remember, we use as clean technique, so we're going to be always covered. First of all, I'll use the iodine prep pad. And so we're going to scrub them really well first. You always ask the patient if they're allergic to iodine before you apply it. Are you allergic to iodine? This is my husband, who's a good volunteer. So, and then alcohol. And so we clean that off. If you need to, you can use a marker to show you where your vessel is as well. And then I always clean off my fingers. So this is our IV needle. So we're going to remove the cap. Okay. I always loosen this right here before I start. Always rewash my fingers. No, go ahead and pump just a few times for me. And I can feel it's real bouncy right there. You want to wash it again before you go in. Okay, just hold still there. And there's your flash. So in this type of needle, we want to pull this back. And the flush runs through. So when you pull that back, that actually extracts the needle. So now all that's in the patient is just a catheter. We're going to tape this down so it doesn't move. And then this is when you go ahead and relax your arm, remove your tourniquet. And this is when you want to flush it. Now remember, if you're pulling off blood right now, you don't flush it until you get your blood samples. So we're going to just irrigate it with a little normal saline. So we're going to attach it right on here. You always pull back first to make sure you have good flush. And then you're going to insert that. You feel right here to make sure it's going in well. Make sure it's not what we call infiltrating, where it's going into the tissue. At this point, I always ask a patient if they can taste it. So it has kind of a funny taste to it. Can you taste it?
Yes.
Okay. And then you can remove this from the tegaderm, and I'll tape down. And always remember, where you put that tape, it comes off. So on hairy arms, sometimes it's bothersome. And then we're going to find our IV bag. We're going to attach this right here. Okay. Typically, I will tape it this again too. I don't want it to pull too hard on the patient. Okay, now let me show you our IV bag. So we do not use pumps. Everything is done by gravity. So when I open up this IV, I'm going to roll this up here. Now that's going to open the tubing, and you can see it's starting to flow in. Now, because it's gravity, all I need to do is lift it up as high as I can. So you can see when I lift it up higher here, see how fast that's going now? So this is all by gravity. So this is 1 liter of fluid, and typically when I give patients IV fluids, I usually give them 2 of these. Remember, that is like a 2-liter bottle of soda pop. Think of how much fluid that is that's going into the patient's body. Oftentimes, this only lasts about a day. However, you'll kickstart the kidneys and they'll get going. You'll know that it's working because the patient will say, I got to go to the bathroom. And so that means that the body's already starting to work through it and it's headed to the bladder. We're almost done. You can see how the entire liter went in pretty fast. I'm going to lower it down here a little bit so you can see what an empty bag looks like. There's nothing left. So you're going to stop the bag. So again, roll this green roll down, or the green wheel down, and that tightens it on the tubing, so now nothing else is going to go through. You can see with this patient, my husband, we actually covered up his arm. Remember that this bag, if it's just not heated up, it's actually room temperature. So it's about 75 degrees. Your body is 98 degrees. So as it goes in, their arms are going to get really cold. So you make sure you cover them up and make them feel comfortable. So now, worst part is getting the tape off. So typically when I pull tape off of the patient, you want to do it quick and fast. So like a Band-Aid, just yank it off. Okay, and number 2, you can see there's a little bit of backflow because it is stopped. So you want to make sure that it's always closed off or else you're going to get a lot of blood out. Ooh, sorry. That's when you apologize for the hair, little wax here. So as you pull the tegaderm off, you're going to pull each corner up. Again, go fast so it doesn't hurt the patient as much. Now, get yourself your 4x4s that you were saving. And so what you're going to do is pull this right up until I'm going to cover. Oh, sorry. We're going to go right to the area where it's in the catheter is. Cover this with the gauze and pull it out. All right. Remember, you always have gloves on because it's going to leak just a teeny bit. And then wrap it up with some Tegaderm. Not Tegaderm, sorry, Coban. Wrap it up with some Coban. Now have the patient leave this on for just a couple hours. Make sure it clots really well. And that's it. Okay, let me know if you have any questions.